Okay, can you hear me?
Yes, thank you.
Perfect, good. All right. Good news is you didn't miss a lot. I have no disclosures. We'll keep moving. So these are our objectives. Like I said, we're not going to talk about personal and professional development with social media. Really, I want to make sure that we can all be able to describe some examples of use of social media for education, thinking about it for research purposes and patient engagement. And then I want to make sure that we have an opportunity to consider where we are using social media in UNMC and how we're using it, and some ideas for how groups can consider the use of social media for patient engagement and research a little bit more efficiently. Okay. So I've listed up here the vision and the mission of UNMC as a whole because I titled this talk, Healthcare Social Media really works with our mission and it supports our mission. And I wanted to be able to show you with the mission that we have for UNMC to transform, to lead the world in transforming lives, to create a healthy future for all individuals. The underlined portions, premier educational programs, innovative research, and extraordinary patient care, right? We know this already about our mission, but how can we translate that into social media work? And there is a huge history of digital media in healthcare. If we take a step back from what we traditionally think to be social media and different platforms, when somebody says social media nowadays, the things that you think about, Facebook, Twitter, Instagram, LinkedIn, these sort of things. But if you take a more wide angle lens and think about social or digital media in general, you come back to things like patient portals, communicating with patients and other clinicians through electronic medical records. We talk about emails, websites, and we have been using these for quite some time to reach patients, to communicate our research, to identify what our strengths are. So what's a little bit about the history? And I don't want to go into too much in depth of the electronic medical record because that is a very boring and long history by itself. But I wanted to share with you a little bit about the progression of how we ended up with this electronic medical record. And so back in the 60s, we needed to find a way to be able to communicate to each other, problem-oriented communications about patients. It was less back then about talking with patients themselves and more about how do we communicate with our co-clinicians. When we're sending people from one place to another, how can we tell them what we did for this patient? And in the 60s, the problem-based oriented records was the beginnings of our electronic medical record. And over many years, you could see the dawn and the progression of the electronic medical record, which then led to thinking about HIPAA and how do we share this information and what can we share and how is it safe to share this information. And then continuing further, okay, we have all of these different hospitals and places that are on the leading edge of innovation to create health records electronically. And they don't talk to each other. They probably don't talk even within institutions. That's not something that we've ever heard of, right? I mean, EHR is not talking to each other. But it was an issue because we needed to make things more standardized. And not every place had an EHR. And then we started to think, okay, well, from government mandates, that's when we started to see requirements that hospitals, clinics need to have electronic health records in order for medicine to be able to be practiced a little bit more efficiently. Move into current EHRs today. There's a lot of incentives that are associated with having certain features with the EHRs to be able to communicate. And then we have different systems by themselves. If you think about the VA having its own electronic medical record, and our other things like Epic and Cerner and other types of EHRs. Somewhere within here was where we started having questions about, can we communicate with patients about their medical issues? Because in the past, it was really all about us talking to each other. And patient portals started to become more common. Once was on the edge of innovation, now trying to figure out how can we communicate more effectively with patients about their needs, and at the same time make sure that they have full transparency to what is happening in their medical record. So this is sort of the evolution of what has led to the MyChart, or the patient portal. And while I wouldn't necessarily consider this to be social media, because it's very much lacking the social aspect, it's locked down under HIPAA, it's password protected and should only be between the individual and their care provider, it is certainly an example of digital media. And being able to take that broader step back and think, well, we have been dealing with digital media and communication for quite some time. What can we take from our abilities to communicate with patients through their MyCharts, through their patient portals, and take that communication of non-sensitive information broader into social media? So have you heard of chatbots? Okay, how many people in the room, or you can raise your hand on, I'm not actually sure how you raise your hand on the webinar, but have gone onto a website for a company, regardless of whether it's healthcare or not, and then something pops up in the site. Hi, what can I help you with? Right? Those are chatbots. So what are chatbots? They are computer algorithms that are designed to come on and start talking with you. They're designed to have a feel of a human being. They're not real humans. There are certain ones that are really advanced to make you actually think that you're talking to a human. There's one on the website called Simpler. So Simpler is something that Dr. Cockett had introduced briefly in December, and that's basically an analytics website for social media metrics. And there's one of the people who designed it is called Tom. And they named the chatbot Tom. And they put Tom's name and Tom's face. And it starts talking to you, and you're like, oh wow, I'm talking to Tom from Simpler. This is pretty neat. And you ask questions, like very specific questions, and the system is so advanced that it can actually respond to you with a lot of the details that you're looking for. Not all chatbots are this advanced. Some of the ones that are associated with healthcare, because it's problematic to really get into detailed medical issues through something like chatbots, you will find that healthcare ones are more just gathering information. What are your questions about your cough, or your fever or whatnot? And once it gets to a certain algorithm, then it says, okay, you need a doctor, or you need to see somebody in the clinic, and it doesn't answer any more questions. But if you think about the progression from the MyChart to the chatbot, there is more of a social aspect that is associated with this. It's more conversational, it's not bound by HIPAA, and there's opportunities to get and use information that patients can have access to, okay? And the goal from a healthcare perspective is to say, well, what can we drive our patients to our website or specific services? When they come to our website, how can we get them to specific services? Sometimes things like chatbots are actually helpful. And so UNMC in Nebraska Medicine has some chatbots with how can I help you? They're not as distinct, but you'll find them pretty much everywhere you go. But if you think about where we're at today in the world and the importance of social media in healthcare? Because that's what we're here to talk about today, right? Why is social media important in healthcare? And I've listed here the top 10 for 2019, the top 10 threats listed by the World Health Organization. And, you can see things that are pretty scary. What I wanted to point you to is vaccine hesitancy. Vaccine hesitancy made it to the top 10 list of threats from the World Health Organization. And why it's relevant to this talk is a lot of the vaccine hesitancy wave has really generated on social media. Now, if you think back to the 80s, when, in the early 90s, when Andrew Wakefield published his false study about the link between vaccines and autism, back in those days, we didn't have this social media construct that we have right now. And it certainly took on, there were a lot of people that were really concerned about vaccines as a result of that study. The journal took a long time to retract the false information. But when it really started to take off was when we started having celebrities coming on TV and coming online and sharing their vaccine stories. And certainly we ended up having people who had questions about vaccines, suddenly seeing these people who have influence in their circles on Facebook, on whatever their social media platform was, and now that gives it a little bit of more credibility in their minds. And so there's definitely been a lot of opportunities for us to look at the role that social media has had to play in propagating myths and inaccuracies about vaccines and even other things about healthcare. So I don't know if you're aware that Facebook and Instagram are now looking at different posts that are being shared, and if they are wildly inaccurate anti-vaccine posts, they are being moderated a little bit more, and that was because of a huge debacle about this. But a lot of other posts are still getting through because they're not obviously anti-vaccine, and it's really hard to regulate things like this because at the beginning when these companies tried to regulate, what ended up happening was even the informative posts were being avoided because anything that had anything to do with vaccines was just not allowed to be posted, and that's not helpful either. So what role can we play as healthcare professionals in things like vaccine hesitancy if social media is one of the premier routes that this is becoming a problem? It means that as healthcare professionals, we can use our platforms to be able to give that correct information. We can use it so that we can share with people who have questions so that they can get those answered by true professionals, not by, I think the current meme is Karen on Facebook. Apparently. I didn't have enough time to grab that one, but there was actually a pretty funny photo about it, about the progression of what medical specialty and expertise has evolved from the all-knowing doctor that everybody is going to listen to, and the scientist, and over years, and now the most listened to expert is Karen on Facebook. So, healthcare social media for patient care and patient education. What are some of the things that we think about when we think about patient care? So building communities for patients. Anybody's heard of Facebook groups? So these are really good opportunities for patients who have very similar healthcare issues to come together, to ask questions. when they're unregulated and unmoderated, can be a really ripe opportunity for misinformation to be spread. But think about the healthcare organization that is intentional about creating these communities and having somebody as a representative to say, we're going to come into this conversation with you. We recognize that you need to have community and you may be asking questions, and we want to help with the answers to those questions. Helping patients to access better care. How can we make sure that we provide opportunities for patients to get the care that they need and make sure that those advertisements are in front of them? So for example, if all we focus on is mailers and flyers to send information about our new clinics that are being opened, and people don't have a mailing address because they are homeless or they're going in between different locations, are they going to see that information? But if most people are accessing the world through social media, through their phones, and you have not even emails, but you just have apps or ads that they are likely to see if they access certain websites, you're more likely to drive them to your new clinic where they'll get the care that they need than if you were going to rely on snail mail only. And then helping clinicians to provide better care. If there's opportunities to have more face-to-face interaction or more dynamic interactions with patients using social media, then the care that we can provide ultimately will also be better. So I wanted to share a little bit about this with you. So this is a study. Knowing what patients are talking about is really important, and what they're searching for on social media can really help you to design a campaign to really get to where they need to be. And so in this study, the groups looked at Twitter, Google+, and then they also used the different websites that people can search for healthcare-related questions on. And they use a lot of keywords and demographic and sentiment combinations to try to get a sense of who is asking questions, what are they asking questions about, how do they feel about the questions that they're asking, what's the mood, and how are they getting this information. And so what they were able to find was that patients who were male on Twitter were really asking a lot of questions about prostate health and things that have to do with sexual health. And that was some of the major themes that were coming. Whereas women were asking questions more about, on Twitter, more about questions that were related to sort of maybe monthly hormonal changes and weight and headache-related questions. If you look at the Google Health and the different forums, you can see differences in the types of questions that are being searched for and answered. When they did their broad analysis of the questions that people were asking for, looking for, what they really found was people were looking for communities. They wanted to find other people that were like them. Because you walk around, you get a diagnosis of whatever it is, and you walk around thinking that you're the only one who's been diagnosed with this. And searching online for a community of people who have had similar diagnoses can be the first step towards that individual making some sort of recovery and coming to terms with what their condition is, and really listening to the medical professionals who are advising them. They're looking for answers, and they're looking for validation. They want to make sure that the things that they're feeling when they consider their condition are not out of the blue. So if you, So if you take a step back and think about just this study, looking at the different questions that are being asked, then you can think about your demographics of the patient population that you would like to target. If you are a woman's health clinic, knowing that a lot of women are asking questions online about migraines and about tension headaches and about ovulation, perhaps could you modify some of your patient education materials to include some of these commonly searched for terms? And if you do that, would you find that you have more patients coming to your clinic because you're seen as a source, a reliable source of information of the things that they're looking for, right? Okay. We're going to switch gears a little bit and go to YouTube. So YouTube is, I think most of us in the room have seen or heard about YouTube, a video sharing social media platform, right? And there are a lot of videos on YouTube. The next slide is going to show you like all of the videos that are on YouTube. Well, not the videos themselves, but just the number of videos that you could potentially access on YouTube. But it's a really great source of medical information if it's done right. And that's the key, is if it's done right. Because there's a lot of stuff out there that's not done right, and that could actually be to the detriment of the goal and the mission of really making sure that we're encouraging patient education and even clinician and provider education as well. And so this particular study looked at YouTube as a source of patient information about lumbar discectomies. So people who have lumbar spinal stenosis go into the surgeon's office and they say to them, no, you have to have this surgical procedure for your spine. And then they go home and they Google it to see if they can find out what they can find out about it. And they land on YouTube. And they say, oh, there's these videos on YouTube of what exactly is going to happen to me during this procedure. And so this group looked at these videos, and they ended up reviewing 81 videos out of the large group that they were able to search for. And all those 81 videos had about 2 million views, okay? And then they had specific criteria that they graded the videos on quality, where they were good quality, medium quality, or poor quality, based on the types of information that they had, based on if people were identifying themselves, identifying what they were doing, and really providing education that was at the correct educational level. And remember, as with any of these medical education, patient education, it needs to be in a way that the patient can access and understand. And so the jargon is not going to be helpful for a patient who's trying to understand what procedure is going to be done on them. And so they found that there were only 16 good quality videos out of 81. I mean, at least there were about 25 average quality, but the majority of the videos about this one procedure were not good quality. And what that means is this is a missed opportunity to really educate our patients. And even if you take another look at it from the medical education standpoint, and you want to show trainees what a discectomy looks like, if an average trainee, one of your students goes in and they say, I want to go look it up, they're more likely to encounter a poor quality video. And is that going to affect the way that they actually learn about this procedure? Okay, so YouTube has 1 billion monthly active users. I didn't know this before I was putting this talk together, how many people were actually on YouTube. And if YouTube, this was interesting, if YouTube was a country, it would be the 3rd most populated country in the world, besides the US and China, besides China and India. 80% of YouTube's views are outside of the US, and people do spend a lot of time on YouTube, 40 minutes on average per day on their app. If you think about the number of videos that are viewed per day, 4 million videos per day. 6 billion hours of video that is watched per day. 18 to 49-year-olds are on YouTube more than they watch TV, cable TV. Videos are shared twice more than in Facebook and text. And 40% of YouTube views come from mobile devices. So if you think about all of these stats about YouTube, what we realize is people are looking for inspiration. They're looking for stories. They want to see what you have to say, and they are willingly going to look for the content. So how can you use YouTube better if you're thinking about your practice or your division or your department, and how can we really demonstrate what we're doing, whether it's patient-related or research and medical education. We want to make sure that we can demonstrate by showing stories. This is what people want to see. Common terms we talked about, making sure that the words are accessible, especially when it comes to patient education. It's important to work with patient education specialists when creating videos for YouTube that are going to be going out to public facing, so that the language that is used is at the level typically about a 4th grade level is what you want to make sure that the language is at, and so that it's accessible for patients as much as possible. And then considering the attention span, right? We have very short attention span, so is it better to have multiple videos that are shorter than one long video? And the answer to that question depends on the content, right? Because if you think about different lectures that you've been at, you could sit down and listen to a person just talk and talk and talk for hours and be like, wow, this is amazing, right? I hope that's the way that you guys think about me. Or you could be in a lecture, and after 5 minutes you're like, my God, I'm checking my phone, I'm doing this, I'm doing that, because it's not as engaging. And so if you think about this same concept with our YouTube viewers, they want to see the content, but they don't want to waste their time looking at your content. So in addition to making sure that they're inspirational, that there's good content, you do want to respect just the natural attention span. And so if your video is going to be a little longer, perhaps build in some breaks into that video that may be a little bit fun, a little bit distracting, and then get back to the serious content. Strong visuals, and then making them accessible. And this is something that is really important, and not a lot of people actually think about it. And in this case, when I say accessible, I mean making sure that people who have disabilities can access your videos. And so there are things that you can turn on your videos on YouTube to make it so if a person is hearing impaired, the video is automatically transcribed. Or it could be on a page, or it could be on the video itself with closed captioning. If a person has vision impairments, there are ways that you can play with the visuals of the YouTube video so that the lighting can change with different contrasts. Different visual impairments will be able to see the things that are on the video a little bit better than if you use just the default. And so it's important to be aware that there are accessibility options for YouTube videos, and that you should explore them and maximize them as much as possible, because you don't know who your viewers are going to be. Okay, so if you think about healthcare, yes?
One quick question.
Yeah.
If you had a
Oh, use your, press your thing. Yes, thank you.
when you mentioned how much YouTube is used internationally, is there an automatic thing that it can convert it to another language?
That's a great question. And yes, there are languages that you can, when you create a YouTube video, you can request that it is transcribed into specific languages. Now, I am not I'm not 100% certain if all of the languages are represented for free, but I have definitely done it where I have clicked Spanish and French translations for videos that I have done. That's a really good question. And then I think with the one other thing about that is if you have an enterprise version of YouTube, there's always paid versions of everything, right? And so working with the public relations department of UNMC to ask some questions like that, there may be some upgrades that your area might have access to if you go through their channels as well. Okay. So using healthcare social media for patient education. I put this up here as an example of an infographic. And this infographic came from the Be Antibiotics Aware Antibiotic Awareness Week campaign from the CDC to help people to recognize why we need to take care and protect our antibiotics. And this is a great example because it is very clean. It shows exactly what they would like to communicate with both words and pictures so that people who can read and people who can't read can both access this graphic and understand the point that you're trying to make. It has a link and a logo so people know where it came from, and it is easily uploadable to any of the social media platforms. And so you can take this image and throw it on Twitter, throw it on Instagram, throw it on Facebook, and it will look generally the same. And this is important for communicating short pieces of information that pack a punch. You want to make sure that the story that you're telling can be told in images as well as words. And so how do you create this kind of thing? There are a lot of tutorials online for how to create infographics or how to create visual abstracts. Those are the two types of terms that you will see. And one particular app that I am aware of that I have used is called Canva, C-A-N-V-A. And this can help you create your infographic. It helps you pick the images that you want based on the text that you would like to add, and helps you to figure it out. It's much better to use, so the app is present on the phone and on the mobile devices. It's also present as a website. From an infographic standpoint, it's a little bit easier to design the infographic on the website than with the app on the phone, just because big fingers, small text, but it's still doable to do that. And if you'll find once you start communicating with infographics like this, people will respond more to it because it's not a group of text that you're asking people to read. You can look at this very easily and say, yep, wash your hands, cover your cough, stay at your home, get your shots. Okay, and you want it to be clean and easy. So short, visually appealing, easy to share. So full disclosure, this is my husband. But I pulled this photo because this is an example of Nebraska Medicine using Facebook Live to share patient information. Okay, and so every so often they go out to different clinics and they talk to different people and they do a live show on Facebook where they ask the doctor, the nurse, or whomever it is that they're talking to specific questions, and they allow patients or anybody who is on Facebook watching to type in questions that they can try to answer. And there are a lot of pros and cons to that. Just want to mention a couple of the cons is, so in any live event, you can always get curveballs thrown at you. And so it's important to coach whoever it is that you're interviewing that there's a possibility that they may have some curveballs. Watch their body language, watch their facial expressions when random strange questions are asked. But generally speaking, these go really well. and they are viewed by hundreds and thousands of people. And so some of the things that I found to make these Facebook Live events go well is that they're timely. And so this one that they were talking about here was a flu shot, a flu season one, where Kayla went in. She was the media person for Nebraska Medicine, so she went into the Chalco Health Center, and right before the beginning of the flu season, talked a little bit about the flu, what it means, how, like, what does it look like, and then she got her flu shot right there live for everybody to see. And she asked questions that patients would ask, and then they opened it for some live question answering, and it was pretty short. This whole thing lasted about 10 minutes or less, and so a small chunk of time, patients can watch it, they can turn it off. And then the good thing about Facebook Lives is that you can get the video at any time. And so if you miss the live event, you can still, if you go on Facebook and you're following Nebraska Medicine, you can still find it, and then you can click on it to see. And so what Nebraska Medicine did was they announced that they were going to do this on Facebook and on Twitter several times over maybe a week or so prior to the event. On the day of the event, they announced that they were going to be doing it. And then after the event, oh, if you missed it, here's the link to it. And so they're still driving traffic towards it so that they can still send that patient information to the people that need to get it. There's always going to be questions about moderation of the patient comments or anybody who is on the Facebook comments, and that is something that if you wanted to hold a Facebook Live event in conjunction with some sort of patient education thing that is related to Nebraska Medicine, that you would want to talk with the PR people for Nebraska Medicine or UNMC to make sure that they either have someone that they can help with the moderation of the questions, or that they coach your group about how to do the moderation. Okay. When I say moderation, I mean some questions you want to make sure that you can answer as many of the questions as possible. Some questions are bait questions to try to get you into a real negative interaction, and some of them you just have to let it go, or have specific canned responses that really they just address, okay, you asked the question, we're going to give you an answer, but not kind of drag things into the direction that the poster was trying to get it to go into. Okay. So here's another example. This is a physician that does navigator nuggets. So Dr. Rochester has her own business, and she actually, I really like this page because she focuses on what are the things that patients need to know about healthcare that nobody really tells them. So how do you pay for your insurance bill? Like, what does your insurance bill even mean? When you show up to the hospital or the clinic and your appointment is at 5 o'clock and they don't see you till 7 o'clock, why is that? Little things like that that are not necessarily practice of medicine related, but things that patients still need to know. And the reason why I bring this as an example is you can be innovative about what you tell patients and what you share with them and how you share it with them. It doesn't always have to be about boring things like, well, your cholesterol, this is what you need to do. That's important. But what else does a patient really want to know about? And this is really kind of tapping into the alternatives, things that patients want to hear about. So for hers, I thought, if you're thinking about what sort of information you want to send out there, be relatable and vary the topics that you're going to be using to discuss things with patients. For patient engagement, this example is from a Twitter chat that recently happened, and I really enjoyed this because there were patients that were on Twitter and physicians and nurses and other clinicians that were on Twitter, and they were asking each other questions. And this, during this chat time, and this question was about what they wanted their doctors to know about them. And we had an opportunity to hear patients talking about, you know, when they asked to go for a walk, like why they really want the walk, or what it really means to be poked and prodded at 4 o'clock in the morning. Why do you need my labs at 4 o'clock in the morning, every morning, and you don't round until 9 o'clock? And have that discussion. And I find a lot in medicine these days, we don't talk to each other, we don't talk to our patients enough. So this is an opportunity to be able to engage patients. Meet them where they are and invite them into those conversations. So this is another way that you can do that. You can also use social media to raise awareness. And so this was a campaign by one of the national cholesterol awareness groups, and basically used Twitter and used the hashtag for familial hypercholesterolemia to raise awareness for this particular condition. And the graph shows how people were talking about this condition using the hashtag around the time of the actual awareness month and then the awareness day itself. And what they're demonstrating is that they were able to tag on to this awareness day to use that to drive information about their campaign. So if your campaign is about breast cancer, then Breast Cancer Awareness Month is a great time to talk about this, but it's not just the month itself, but the times leading up to it and the times after that you can have these conversations. They could have come in and sat down. Okay, so we talked a little bit earlier about misinformation on social media. And there was a really interesting paper that I wanted to share with you that had some thoughts on how to protect science from misinformation on social media. So provenance, you know, if we think about the origins of our data and scientists being the ones who are creating and sharing the data, we do have to recognize that we have to tell people who we are and why we're experts in this. And that is part of the important reason for them to listen to what we have to say versus Karen on Facebook, right? But the other thing is really engagement. How do we talk to the people that want to hear the information? Can we be transparent about it, about the things that are positive and negative? So like, yes, flu shots hurt. Sometimes you might have an injection reaction. Sometimes you might have pain for a few days afterwards, but it does not cause autism. And really recognize that there are things that you can share that are still negative, but if you share it using your expertise and explain it at the level that people really understand, then you could make some headway. Really using patient and clinician narratives to drive storytelling. And again, going back a few slides, we saw that people want to hear stories. Then the reputation of yourself as an institution, organization, as an individual, using and leveraging that reputation to be able to share that mission. And then connections. It's important to build connections and maintain connections with people as we're trying to share information with them. So this is another area where you use social media. It's an app called Cure ID, where people, you know, ask interesting questions about a case, and they don't know the answers to these questions. So this group created this app so that you can ask these questions in a social manner and crowdsource the answers. People do this on Twitter all the time, but this is a way that you can concentrate to your specific specialty. So think about ways that you might be able to come up with an app that you can crowdsource within your specialty or your area. And this is just an example of what the questions can look like. So medical education, the ways that we can use this to really do medical education, it's innovative. You have to make sure that what you're talking about is brief, accessible, and these are some of the these are some of the ways I've seen medical education on using healthcare social media, Instagram, TikTok, Twitter. Have you guys heard of TikTok? I didn't know what it was for the longest while, and it's interesting. And so there's a lot of physicians that are out there with these small snippets of videos that are educating people. So you can check it out. And learners, reaching them where they want to learn. So a lot of our education happens not in the classroom anymore, but online. And so having apps or even Twitter accounts where it's just feeding out questions and having engagement with learners is important. So Twitter and social media really is changing medical research. It's changing medical education. You can use social media to talk about your trial. And so this is an example of the Marino trial, which basically published this really important practice-changing data in infectious disease. And they created their own handle on Twitter and engaged with scientists and physicians and clinicians on Twitter who asked them really tough questions that helped them to improve the way that they answered and the way that they presented their data, go back and look for more data, kind of a post-publication review. This was really helpful. And this is an example of a new trial that's going to be starting, the SNAP trial. There's a lot of opportunities to use it in clinical trials. You can sign up your research group, treat patients as partners, and so actively engage them, and engage healthcare providers using social media as well. And then using social media, you can ensure that you're targeting certain groups and that you may be able to get more diversity of underrepresented populations in your clinical trials, which we know is a really big problem at this point. And then communication about your trial using social media. I'm not going to spend time on this because Dr. Kaka did share the study with you guys in December, but you can, after you finish your publication of your clinical trial or whatever research, you can affect dissemination and access to that research using social media as well. And using Twitter chats, you can build momentum, engage influencers, and keep discussions going. You can promote your projects across multiple platforms, and you'll see that you have more engagement. And when you're at meetings, you can tweet at the meeting. And then that also drums up responses and engagement with your clinical research that you're doing. Equity is something that is important, and advancing equity, you can use social media for that as well. And so there's a lot of examples here of hashtags that have been used for advocacy within medicine. And they are really significant and successful campaigns to increase certain groups in medicine, as well as increase awareness for vaccines, increase awareness for harassment and gun violence, a lot of opportunities to remain advocates. One last thing, social media and science, where I think they don't mix, but they may be like going into that direction. There's a new app that people from Harvard are creating where it's like a Tinder app that will match you with somebody that is not going to create children with one particular disease. So it's basically Tinder, eugenics Tinder, right? The goal is to eliminate certain life-threatening diseases or concerning diseases, but you can see how it can be used for other nefarious reasons, okay? And then the other place that it doesn't really mix is some healthcare social media influencers. There's a lot of conflicts of interest, and things can go really south really quick. If you want to read into this a little bit more, it's a really interesting story about a resident who posted a lot of inappropriate things and has his own side gig, and it just kind of went south for him very, very recently because of what he was posting on social media. At the Great Plains Idea Center, we have a lot of ways that we can use social media, and I can just put through things that I've seen from Twitter that have been shown. At UNMC, we put our fellows stuff on the blog as well, so you can use education on the blog. And then this is the YouTube channel for UNMC for patient education. As you can see, the videos are very short. They're questions that people want answers to, and they are viewed by a lot of different people. And you can see these are the same videos that come through on UNMC Today or on the Now, but they are patient-facing, and everybody has access to it. So the summary. For healthcare social media, does it work for the mission? Yes. Just jump in. Just do it. Be authentic. Be you. Make sure that the people that you're using to represent the mission and the value of your institution, your department, but does not come off like a robot. Focus on engaging others because that's what people want. Use bright, catchy media. Use infographics. Use visual abstracts. Be innovative and try new things. Try different platforms. Always remember the pitfalls and be careful about those. Okay? Any questions? I know we're on time, but if there's any questions, you can always email me. Hit me up on Twitter, and feel free to share any of my slides that you'd like to share. They all have my information on it, and I didn't mention it in the beginning, but I'm quite open to anybody tweeting the presentation. Okay? All right. Thank you, guys. Thank you.